very much, Dr. Grover. Well, I think there is a little that we need to be debating about as regards the uniformity of standard. I think that is the main problem that we have in India, whether it be just a graduation, a school, or whether it be MBBS or whether it be post-graduation. What is important is that we need to have certain things that need to be of a particular level. Yep. Okay. So when you're looking at UG teaching, when you're looking at ophthalmology, the main thing is that undergraduate is basically the introduction as to ophthalmology, and what we need to see is that the doctors who come out, the general practitioner whom Dr. Panda was just talking about being the link, so they have to be the link for ophthalmologist also. And that is what is very important. So typically ophthalmology is not considered to be a major specialty, but still now I think with the new curriculum they have to pass ophthalmology separately. So that is something very important, and they need to be able to identify certain things which are related to the general medicine and to the what the patient is doing. Now, as you look at the whole thing, this was an article that was written in IGO, and what we say, what was the question that was asked was that are we able to showcase modern ophthalmology to the resident? That is the most important thing, that when you are looking at the teaching and the level of the doctors who are teaching ophthalmology in various medical colleges, are they knowing what new technology is? Are they knowing where ophthalmology is going? And are they able to take this to the undergraduate? So majority of the undergraduate residents do not see even a phacoemulsification system or lasers or modern diagnostic systems. So they get a very primitive kind of a knowledge as to what exactly ophthalmology is, and often it also does not enthuse them enough to make ophthalmology as their choice. So the importance, therefore, why is it important that the ophthalmology training should be of a particular level to the undergraduates? And what we feel is that the first thing is that it should be able to motivate them to kind of know what ophthalmology is. Till they see what ophthalmology is all about, they will not be able to even want to become ophthalmologists. Second most important thing is that they should be having the basic knowledge so that they can refer the patients to a trained ophthalmology. And finally is also they should be able to work on to getting the PG exam cleared. Now if you look,
maybe as medical officers in wherever they are, be a primary eye care.
Yeah, so that's what I'll be just talking. So basically the statistics according to the ICO, there are the number of eye doctors that is there is that they are much less. If you look at the population, there are 29 as compared to 11 per every million in India, and this is a significant lack of ophthalmologists. So until of course you are having this new batch of ophthalmologists coming in, that is not going to take care of the Indian ophthalmology, especially in tier 3 cities and in rural areas. So that is still a problem. Blindness remains a problem. So we need to have ophthalmologists, and this gap can only be filled if we have an upgradation of what is being taught to them. So there is therefore a need to motivate the students to take up ophthalmology, and I don't think anybody will be motivated enough if they are only shown a torch to look at findings and be talked about certain things which are very, very basic. Now the second important thing which you were just referring is the timely referral of a patient to a trained ophthalmology. That is not done. There are ophthalmic signs need to be told to all MBBS people that as a consequence of many systemic diseases, there are ophthalmic signs which need to be looked at, and there are numerous systemic diseases, they have ocular manifestations. And often it is the eye findings which become the first thing at times, which we all know that if you have, for example, the ptosis, you have the leash nodules, so you need to look that this is neurofibromatosis. Even if you can look at thyroid disease, often it's the eye problem which at times is manifestation that you have to see, that you have to get a thyroid examination. One important thing is we are having more babies born prematurely, living their life, and there are even several problems which the people, the medical officers have gone. There are recent litigation charges that have been given to the patient, that they did not even ask for an ophthalmic review, etc., because they were not aware that these are the things that need to be looked at. Other systemic disease, they should be knowing about collagen vascular disease, peripheral ulcerated dry eye, Sjogren's, etc. These things need to be looked at. Diabetic retinopathy is another thing where the doctors have, who MBBS have not seen diabetic retinopathy changes, and they haven't seen enough patients of diabetes going blind. So that basically becomes a problem. So they need to be told and educated, and that has to be done at the MBBS curricular level, and force every diabetic to go in for a retinal examination that is there. Now, if the importance therefore of this second point is that even if they specialize in something else, they should know as to when a person needs to be referred, and a timely referral for an ophthalmic consult is important. And I think the third important thing is to complete the curriculum, and medical education is supposed to cover every part. Even though we are going into super specialization, we need to know the basics of every part of the body, and eye is one of the most important sensory organs, and knowledge on ophthalmology needs to is required to clear the examinations and to qualify for post-graduation. So I think from our little perspective of Center for Sight, we hold a wisdom tree wherein we try to get teachers and professors to come, and we try to bring up their knowledge levels and the skill levels as to what is new that is happening. That is something that needs to be looked at. There has to be continuing education of the doctors who actually are teachers in ophthalmology in various medical colleges. I think even at the AIOS level, these courses should be taken up, whether it is at this particular level or others. And then obviously the credit rating system is still in its infancy. That needs to be every doctor or ophthalmologist who is in the teaching field should need to upgrade, and the trainer needs to be trained. That is something very important. And I think the new technology, whether it is possible or not, but I feel that the ophthalmologists who are undergoing ophthalmology, if the medical college does not have these good kind of equipments or whatever, whether it be the retinal lasers or it be an indirect, even those primitive things, they should at least for a day or 2 or 3 days be given an exposure in any private. So there should be, I feel, a private-public partnership where the doctors are exposed to what else is happening in ophthalmology. Thank you very much for your